Iqaluit. It is Friday, March 26th. Oh my gosh. We've been at this for over a year. As always, Premier is up first. Dr. Patterson has some announcements to make. We also have the Minister of Health, Minister Iqaluit, here to answer some questions. And then we'll keep it the same as always, one question, one follow-up, and we'll start over here with Trevor. Thanks.
Ulla sa kullumitan ng March 26 akagulimate na iliw si maliktigun. Tana si buliktiyo kalimalawlo ni Luta Patterson o kausit sa kalangayok ang malo Minister Kusugatuin na mayok apirsok daw gumapan.
Nunavut Blacha, Uglumi Awinilit 6 Uglut Awed Nuban Naryo Kangilak Nutani, Awami Uwenekuni, Tana Kayuhit Charlie. Uglumi mitikid luguta ko Nunavut mute Kapio Himayo Hibula Pamita Nuban Naryo Tare Guti 12,884. Matako taon Nunavut mute na Kingunliani Kapio Himayut 6,784. So takwa Kapio Taranit Chasoti Nunavut mute 6,785. Kugane ko ni Kapio Wadlela Matatako Nunavut mute. Okaujo Himagamatako Ilangit Ihumala Homata Takwa Kina Pami Matwame Atok Tangitut. Takwa Nunali lang atok akang itu kihani atok patapiw na kawyok ta na nuban na kayo anyang na kawyaman na huito mat nunaling mutikil at wakayang napat tat ko kinapak himaguptam ikayo kayang mat nuban na kayo ta ning nuban na kayo ta rin nami ta na nuban na kayo anyang na tayo itang niluin na makinamaya mo nunaling mut inung muta nakawihay nakakaptiguta ko malikta ko yo anya talititsi ko ni malitsa law la buhulita ko ang agaw ang migtalugit kanigilo ak tangiluta ta ko malitsa nakakabut amatan na kaput nuwan na jo ta regutit na nuwan na yo COVID-19 mi unatang man nunav mutilok to chapaka kapiyo himangin na huli kapiyo yaktorit Tana Kapio Himalo Guvita kwa Nagligiyatit Pakandatit Ilagayatit Tako Ekayon Nian am Ingmito Ekayon Lutitako Nuban Nario Tari Kaput Atud Laringman Nuban Nario Mikapio Himangin with Nunavut Mute Kapio Yaktorit Nuban Nario Tari Kutimi Matana Dr. Patterson Iswa Kaim Marika unikal na lang mingmat ako wala mga ata nuban na yung Amerikano Nunavut luani ako ba miluat yo so ta nibyak na lang magwatchakot na. Good morning. For the 6th day in a row, there is no active case of COVID-19 in Nunavut. Way to go, Ahmed. To date, 12,884 Nunavut mute have received the first dose, and 6,785 Nunavut mute are fully vaccinated against the virus. I've had a few messages from concerned Nunavut mute about people not wearing masks. While masks are not mandatory, they are highly recommended and still an important measure. The reality is that we don't know when and where COVID-19 will reappear, so we need to maintain our practice and be vigilant. The virus is still a constant threat. Please continue to be cautious and minimize risks. Continue to follow all public health measures. The vaccine is also an important step in our fight to limit the effects of COVID-19. Please make an appointment to get your shot if you haven't. We have the vaccines. Now it's up to each one of us to make sure we do our part for health and our communities and our loved ones. If you're not vaccinated, please get the appointment, make an appointment, and get the vaccine. I know Dr. Patterson has some important announcements, so I'll let him get to that. Have a safe and healthy weekend.
Good morning. Effective Monday, March 29th, travel in and out of Aviat will no longer require approval from the CPHO travel team. However, people still under isolation after exposure to COVID-19 are not allowed to travel until their isolation period is complete. It is very important that if you are still required to isolate, you do so for the full period. This will reduce the risk of further transmission of COVID-19. The community and health teams have worked hard to bring Arviat back to no active cases, and if we are diligent, we can reduce the risk of additional cases. Anyone under isolation who breaks isolation, including travel out of community, could be subject to a fine under the public health orders.
Lasakut pigialuni nagajami March 29. Aula hataw namningin tikipiw hataw namningin akviani tay mangit taw hataw atulagon nito tatsuma anna hamnangit tuliri jumari kanayak tinginu. Kisiani kikutuin na itsuli teilige haktut no vajuanak 19 mo kati yakaktu minit suli aulare hangitut anit teilige hamningi piyari laungin Pimari ubok suli tako anit teilige harobi tako atangyatuni ulluni anit teili khuyaunak ni malitsa khuyaulutin tamanna sermatit siteiligutiugunna no vajuanak 19 mi Nunalin ni amaloana bimepili khatigi tako atsursimamata akviat no vajuanak tuhakonne khullugo Amalumalit siya tuwin na uguta tayo makakakan nga gun no vajuanak ta teilit sigunakata kina tuwin na ni teili kuyaw si mayok si kumit sigun itat kuminga maligayalin minik ilagay yaw na ulak ni kunin nunaminik tayo makakilit itaw tuwin na kayalik tako ana hamnang itularin ng mamalit taw gayali pilugi.
This week, we surpassed the 50% mark of adults across the territory receiving their first dose of the vaccine. This is great news, but one dose is not enough. As second dose clinics roll out across the territory, I encourage those who receive their first dose to also get the second shot. Those who missed their first dose can still call the health center to make an appointment for the vaccine. It is not too late, and vaccine is available. Out of all of the measures that keep us safe, the vaccine is the most effective and our best protection against COVID-19.
Tabani pinasausang mekhangiw tilok tugo 50% tako innait Nunavut mi kapiyaw si malerningin na subulak pasyum. Taman na tusakuminak to kasi anataw siya to kapiyaw lunin na mangimat tulian ni kapiyaw hat niak to sulit amani Nunavut mi. Ayaw to hakko kau tiga sugitay ko subulak pa mi kapiyaw lok to tulian ni kapiyaw kan ni kulugin. Dai ko kapiyaw gunak silang ito subulak mi sulian na bimeno kau ukhala gunak to init saliolo ti kapiyaw gumanaraloting kingo balawangin mat amalo kaputi sulatu inna mata tako malitaw gali atana tumitay liguti bo pilugita nakaputi atu ti khatsang nakpangoyo amalo sa pumiyaw siya nakpanguguti gunak no vajuanak 19 mo.
As many know, the Iqaluit Association will be holding its election in Arviat next month. We will ensure that public health measures do not prevent these important activities from going forward. To assist elections during the pandemic, we have developed guidelines that will help organizers safely plan and hold elections. I want to wrap up today on a lighter note. As many know, spring celebrations are right around the corner. To help with these celebrations, we have issued an order that designates the Honorary Tunic and Ollie the Muskox as providers of critical services, specifically the delivery of springtime celebrations, fun and games. This order exempts these important figures from travel restrictions. They will also be allowed to enter dwellings to check on children, and they do, but they do have to practice social distancing.
Amay sulot ako yung magatakiwan lang mino ikatutsi katigingit nirwang nakalangat ako via mitakhiwlak to me. Lalo na sisimani ako na hamnang itulirin ng mamalit tao galit abbe ako tao hunagita magkunong apim mariyo yun kanuili ako tao galin nun. Ikayok tao hulugin nirwaktit siniyakto taman na siyang mapalian ako hatilugo akitsu isimayugo malit tao galin ni tamakko pang naiyingit at tanang ituko pang nainiyangata malo nirwaktit siniyangata. Ulumi piyari ko takaro mayong ako via naktumi ukaw sa karluta amay sulot ako yung magataw pero nga ako via suit kakatam na lang may mata tamako ako via suit ako na hulugit ako taan na tilisud siya tiliyok si mayo naluna silluni taina tundiq ammalu aali taina umingmak taakua pimmariyuni pijitseraartiuni angata piluartumi upengaakko huviassukatigiittitsinirmun pinguartitsinermullu taana tilisijjutiujo taakua pimmariyunik aullattailigiatungittut ammalu taakua illunu isserunnartu taakua surusiit naalatsaaleqaluarmangata hauyasaqattarlutik kisaanittau inuuqatimini qanitsaluariarhanngittutsuli.
Yes, fix this or okay. Are there any concerns about Trevor Wright, Nunavut News up? Are there any concerns about I guess there being an election in Arviat so soon after the last case is recovered? Or?
Trevor Wright, Nunavut News kunni taikko nerwa isumaluti tahaqar veani nerwa toqalaatillugu khilamiuluangin mangaatianna kingullerpaami nuqadjuarnartu maanna maangulauttillugu.
It won't be the same as elections prior to the start of the pandemic because of the restrictions, but the election can continue, and experience across or from other jurisdictions has shown that it can be done safely in circumstances like this as long as everyone's careful.
Tanadjujaangittuugala nerwaarniuqattalauttutiu kisiani taima kayusigiaharmigatta tamakku mga nerwaartulerinerma asinginnilu avittorsimayi viuyuni nerwaartitseqattarunnarsimayu attanangittukkun.
Is there any way Health or the GN can prepare for the introduction of any of the variants that are COVID-19 variants that are out there?
Ana hamnangittulerik zikkun nunavugavamakkum illu upalungayarsima vatamakkuninga asitseqpallianiuyuni nuvajjuanarmi tikittoqaarneqqanunavummu.
The variants are still, they respond to the same public health measures, masks and washing hands, maintaining distancing, all the other things that we've been doing for the last year. So some of the variants are, the protection from the vaccine is not as good, but still there's some protection. The important message is that we take advantage of all of these steps and measures that we have at our disposal to keep Nunavut as protected as possible.
Taako asitseqpallianeqartaayu nuvajjuarne sulitaimaatsainna isulit ila siarmartailititaugunnartu maliqattarsimajavu taakkuningatsainna suurlu matuarsimaqattarluni aggavu waasainnahattarlugu inuuqatigi katiluaqattangillutik taakkualu ilangi hasitsipalliayu nuvajjuarnau sapummijau jutiugunnartu taatsimunga kapuutimu taimaatsainaungittuugalua kisaani sapummijauгутиугуннартут taakkua nalunangittu malittaugiali nunavummi suli maliqattarniartavu nunavummi sapummijaussimatsiaqullugi.
Ullakut tobi utak CBC kunni tema aqveani kingullerillermagut nuvakjuarnaq 19 ni aittorlui katagunni nermi taanari kingullingat qannoq atuuteqarniarpat sivullinganni piqarunni laortillugu atjungittumi pilerinearpisi. This is now the second no case of COVID-19 in Iqaluit for a while. What have you learned from the first time that the Iqaluit had no more cases for a while?
Sorry, as a just gotten into the habit of waiting for Uli to interpret. So in January when Aviat got to zero, what wound up happening is that, or what we learned from that is we reduced the number of people allowed into houses, and we've been recommending that people stick to a 2-house bubble where it's just going back and forth between the 2 houses. To try and minimize that risk, because in all of the situations where COVID's been in Nunavut, the vast majority of transmission has occurred in houses.
January utillugu arviani taimano vajaanartu qarunni kainala utillugu tamanna iligutigissimagattigu tamakko illumiu khatigiingi tamino isikhattaruungillugi taimaimma taikko maqqu illumiu khatigi pulaarea khatigi khattarunnartissimaleratigu manna tamanna ulureanartumi tailititserulluta siarmartailititauningani tamakko nuvajuanartaarutawassima yaamisu nunavummi ilunnatigala illumiu khatigiini siarmartauqattarsimammata.
Dustin Petard, Untitled News. Dr. Patterson, so there's no cases in the territory. We've received all the doses that we're supposed to. What are some of the biggest questions regarding COVID on your mind right now?
Dustin Petard nunatsia kunni luta Patterson taimano vajaanartu qarunni tillugu nunavummi tamakkualu tikisimalertillugu kapuutiu yulima taimale qanuilernaalaqita qanu apeqqutissaarnerpaangugayaqqi.
The biggest one on my mind is probably the same as most people, and one of the most common questions that we're getting right now is what happens after all of the mass vaccine clinics or community vaccination clinics have been completed. We know that it's about 2 weeks after the second dose or 6 weeks after the first dose that protection for the individual who received the vaccine is at its peak. What hasn't been fully measured yet is how the vaccine impacts the spread of the virus.
Tana apequtiuna paangu yutaima China misunu yutsa vok taima apequtiuga yuppattunilo qanuilernaalaqitali taima tamakko kapiyo hattalet simalertilluga miusuunersainunavummiun taakko atuutiqarpalliassitainnarunnaq hattanga tamakku pinasarussiina simalertillugi tulliani kapiyaulortillugu ammalu qauyitsariaqarattigu qanu tamanna kapiyauqattarnissiarmartailititsigu taugunnarmanga.
So the question is, once we get to that point where everybody's had a chance to get vaccinated and had 2 weeks after they're fully vaccinated, how can we move back or ease some of the measures to get closer to a more normal life?
Tana tawapiqqutiu qataummiutaima amisuunersai kapiyaussimalekqata ammalu tamakkiinni amisuunersai kapiyaussimalekqata qanoq tamakku qassuyauvallianiarmanga taannaaqarnangittulerinaama malittaugiali tamanna issumarsarsiurutigivalliagiaqarnialertavu.
There's been a lot of talk over the last few months about a third wave in the South. Yesterday there were 5,100 cases, which is the first time there's been that many in one day since January. As the South case count rises again, are we doing anything differently to kind of prepare ourselves for a potential third wave?
Uqausaqartuqainarsimamma taima pingayoanni siarmapalliajoqal giallalerningani ippatsarlu 5,100 naluneertaulormimmata taana amisuunerpaangussimaluni January minik takko amisuuqpalliakannilertillugi qanu palungaayarsimavi.
No, not at the moment. If we start to see cases slip through the hubs again, then we'll respond when needed, but we haven't changed our plans at this point.
Gamanayo takko asijjartausimangittu takko kisiani siarmartoqarneqqataakkunangainutuuviugaali natujormivimmiingaartuni taima kamatsautigi pallialerajartigu kisiani maana asijjartoqatsaangittu.
Emma Tranter, the Canadian Press. How many people are still in isolation in Aviat?
Emma Tranter, Canadian Press kunni qatsiuvaarviani taakko anittailigaaqartitauju.
I honestly can't remember. I can't remember the exact number. I know that there will be people in isolation until April 3rd, but the number I don't know.
Iqamangittu qatsiumangata kisani qauyimayugaloa taakko anittailigaaqartu April 3 mono.
With the travel restrictions removed, at what point will we see schools move to a new stage in Aviat?
Taakko allaqqattarunnarnialertillugi tikibbiuqattarunnalaalertillugilluli taima qanu taakko ilinnaarbiimatuippallianingaana qanu ilinganialeqqa.
After there's nobody in isolation in the community.
Anittaili joqariaqarunniitsaaqqa taikani nunanganni
Jackie McKay, CBC News. So far, there have been nearly 1,200 incident reports filed from the isolation hubs. That's almost 100 a month. They range in severity, but I'm wondering what happens to those reports once they're made, and who makes decisions about who's kicked out of isolation hubs or if people need to be reset.
Jackie McKay, CBC, kun ulumimo 1,200 kasaulang ngatago takwa khanili gutaw sa mayo to yung mevinyani tayo view yuni solo 100 takitaman bilang ipimari na saulutik takwa tukaw siugay mata kiko isumaliyo ko takakatak kiko ani tawga hang mga tatay ko na nga to yung mevinni.
So the incident reports are all reviewed by a public health physician, myself or one of the other two that's been working with Nunavut, and that's strictly to decide if it's if the incident represents enough of a breach in the isolation protocols that it could increase the risk of acquisition or transmission of COVID-19.
Tako kanili tumini utilugo ukausugay mata kimiko yaw katak tulutano tatsumungalo malumako kanino lutano tako kanutigi sikumit sa yumini mga balo sa malakutagun ng mga ta sikumit sa niminingit tako aniteli titaw tilugit sa maktitsiteli ng mo pichuti kalawang wakto tatay mahas maliro takatakto.
If the public health physician reviewing the incident feels that it could have resulted in exposure, then the 14-day period of isolation restarts effective the date of the incident.
Tana ana hamnang itulang na muluta kimiko yo isumapatamakko sa maktitsituin na kayak tuminiw ni nga ni tayo mga sa kumitsitilugo malitaw galin ni tayo mga 14 ulo na pigakan ni sa katakto 14 ulo nalaw ng Iqaluit.
As far as making people leave the program or go to a different hub, that's sometimes a public health physician decision, sometimes it's a joint decision, sometimes the hotel itself has said that an individual is no longer allowed to be in that hotel. So it depends very much on the circumstances.
Tako ali tayo katam ni tayo mani tayo view yun at sige katang ito so luluta mo isumaliw ko tayo katakto ubalo katud jawlo ni piliri katigi no isumaliw ko tayo katakto ilan ni ko tuyo mi vida ko ukakatak medyo tana tuyo mi bimbiga harunik to kalaki ang ani tayo yo kaktilugo tuyo mi binno ilan ni ko isumaliw ko tayo katakto.
In circumstances where someone has been banned from hubs or has to reset several times, they're struggling to make it through. Have you ever sent people back to the territory without completing the 14-day isolation? And can you talk about the circumstances that would be under?
Tako ali kanili yung miniutilog tayo maandi titaw gaya kasi katakani tayo yung nitako na nito yung mibini amalo Nunavut motak titaw yung kalaw sumaba 14 ulo ni nalaw tinago.
Yes, as we've talked about before, there are circumstances where people cannot complete isolation in the hubs in the south, and so where possible, we work with them to find other ways to minimize the risk of them introducing COVID-19 into the territory. And it inevitably, or most often, involves some form of isolation in territory.
Hakkaw gamay la kanili yung hakto minutillugo tayo mapiyaki kung nang nanging batawlo ni 14 na ni teliga kam nang mukhallo na ni tayo may gun na kay gata utas sa kayo tutsi katakto taman na nubat yung 19 sa maktaw tayo litit sa akto tayo masulo ang ikangamin ni teli nga akong naktitawlo ti.
Ken Driscoll, APTN National News. I just want to follow up on Jackie's question there. In your answer, you said people who cannot complete isolation. I'm wondering how many of these cases are people who cannot complete isolation or simply cases of people who will not complete isolation?
Ken Driscoll, APTN kung napirikan ng nga tayo sumapik ko tigikaw yung itako piyaki kung nang indarat at yan iteli titaw ng minik hatsiw si mabat tako piyaki sigo mang ito upalo piyaki sigo nang ito tayo manit teli gaham ng
As much as possible, we aim to ensure that it's people who cannot, that it's just simply that they're not choosing to do isolation, but they have challenges that make it impossible for them to participate safely and satisfactorily in the isolation at the hubs.
Teima atso takakatalo tugu toaga hasuta tamakua pijarir sigumna hatangittu anitteiligia hamner meilangit teima pijaring Iqaluit ilangi atsururnartukkuurutti hamut pijarirunangit saamari hattangata teima kanutuina asingitigu anitteili tingaga soahattaqtagu.
And so the majority of those people have medical diagnoses or other challenges. We do we look at each case on an individual basis and get as much information as possible, and it often winds up being a discussion involving a number of staff and individuals and trying to find the safest way to get them home with minimizing the risk not only to them but to the community and to the other people in the hubs.
Takwa misuunersait sullu anniannermu nalunertausima yumpalo assinginni atsuornaq rutihartuut haajigassuaqattartugu takwa atuneertartaullu terimiqqujauqattangata tukisivigitsaaqassuarsugiit atjigiingitulu qanayartiit uqaqatigiissiqattarsuti qanu attananginnerpaakku angeqqama utertitaugunnarmangaata taaktsumungatu attananginnianu kisaanittauqa nunaqqatiminut ammalu tujurmivimmiittunu attanartailititsinnikku tamakkua.
Dr. Patterson, as I'm sure you can appreciate, one of the questions we get asked to ask you, the most frequent one that I receive is, when will there be changes to the medical travel hubs? The thing is, with the medical travel hubs, Nunavut's only part of that equation. The conditions in the south are another major part of that equation. What milestones need to be hit in the south in order for you to consider changing the 2-week medical quarantine policy?
Luta Patterson hauimayuinaugatta taanna apiqqutiuga juttuuq taimangalima taakkoa hangaasitsertaulaa mangaata annaamilaartunut anitteilikainnahattariaharni Nunavumutilaunginninginni taakkoa alu issamagiyaugiahartut saummata hallunaani hanuiliorniujut ammalu searmapalliallarinningit kissumutikiutissimagiahaqqita taannaasitsertaugajarneqqa maqquunni pinasaarusiinni anitteilihattariaharni.
With the access to vaccination, the biggest question for what's going on in the south is what percentage of the what percentage of cases of infection are related to variants where the vaccine is no longer protective or is not protective. And so that figure is much more important than the absolute number of cases at the moment. So we're keeping a close eye on that, and that information is changing on a daily basis. So it's really, I can't predict it right now.
kannernnersauleqqata kapuuttinik apeqqutiunerpaa taatnaqallunaani qanutigi taakua presentingi taakua siarmartitsivalliammangaata ammalu asitserpallianerartaujus taanna qanuippalliammangaa qammalu kapuuttimu sapujjausimagutaut searunnaraluarmangaa taakua qatsiunningi pimmariunersaaju taannalu qaujissat seanginnarpallianeartavuut taakua ullutama asitserpalliaqattangata tamakkua tukisigiaquti.
Toby Otak CBC Kunik Nutakanuli Kaputik Sanit Nuvakjwang Nakta Jekutimi Pitakarak Sari Twinarakarak, but will there be vaccinations for children soon?
The research is happening right now. I don't expect that there will be any vaccines for children, or I think it'll take at least 3 more months, maybe longer, before there's a vaccine available for children.
Tamanna haujissartauvalliamma tamakkua neriunangittu maannau yukiseni kai takki pingassunaasimalle khata neriunartu taakku arserusi kapayaw khattarunnarsilaarningimmi.
In the meantime, what will happen to those families who has children that has immune problems? Qanuinnaariqpallitei mataakkuat ilagiktunut nutaqaqartuni aannersaqaittuni.
It's a good question. The reality is that at least half of Nunavut cannot get a vaccine right now, or close to half. And so that's one of the reasons to continue to maintain at least some of those other public health measures. Me getting the vaccine protects myself as an individual. If I maintain the public health measures, wearing a mask, maintaining distancing, and avoiding large crowds, that helps protect all the other Nunavut who cannot get the vaccine at this point.
Taana pekutit siavak sulimmanila abballoangin Nunavut kapayagunna jaangimmata taime matana pejutit sianguvutakwa ilangit aannaharnangittulanner mamalittaugia khattartut kapayaw ila malittaugia harninginu ila atainarneangata taana kapayawsimatillugu taatsumingatuat sapujimman kisiani taimaatsainna malinnearuni taakkuninga suulu aggamini waasa khattariaharne inu khatigini qanitsaluattailineq amisuuluartuniittailineq taakkua suli malittauppata taima taikko assingi sapummiyagunnna khatauneartu piassimangittui
Taakkunangari qitungaqsaqartunulli naammak pataakkua kaputiksei. Can pregnant women be vaccinated with the vaccine that's available now?
Yes, since the vaccines were first available, we've allowed pregnant women or women who are breastfeeding to get the vaccine. And this figure is at least a couple of months old now, but there have been more than 10,000 documented cases of pregnant women getting a vaccine for COVID-19. And there's no evidence that it increases the risk of miscarriage or birth defects or any other problems with the pregnancy. There's no evidence that the vaccines impact fertility. There is evidence that infection from COVID-19 during pregnancy is high risk for complications. So we would encourage and support all women, pregnant or breastfeeding, to get the vaccine. All adult women, sorry.
Okay. Taimanga taana kaputi atuina ulilaungani taakkua kapiyaw khataussimagunnarsimayunnatsisut ammalu iviangirmina maamattitsi khattartut taana maqquutaqqiinaasimalertiugalua kisaani taakkua 10,000 ungataaniittut natsiju kapiyawgunnarsimayu nuvajjuanartaartailerutimun qauyinarsimangittuorsuullu taakkua nadziangi qanuigutaqarsimangittu akaungiliorutaqarsimanatillu ammalu nadsilirunnarnimmu taana abbiarutausimangittu taakkua nadziluti nuvajjuanartaarneruti ulureanartumili rajangata taimaima qautigiartangi nadsiyut ammalu amaamatitsi khattartu kapiyawqatauqadlugi.
Untitled News. This could be a question for anyone. Has the federal government reached out to talk about a vaccine passport?
Tasne Patterson sekunni taana kiakkia kiugunnartanga gavamatuqakku qalauqqaat taakkua suullu kapiyaussimalerluni paippaami aullarunnau tiuniaraanga uqartoqarsimava.
I'm not aware of any such contact or discussion other than what's in the news, and it looks like nobody else is aware of that either.
Kauimangitu tamanno qausiuvalliassimammanga pivalliayunitu saqattarsimayaqaluanga kisaani qausiussimangittu ullumima.
With spring and summer quickly approaching, are there any changes anticipated as to who's allowed to come to Nunavut? I'm thinking along the lines of various types of workers.
Upengaunaalanga oyaqulallertunilu taakua sitsertaugunnalangava kikkununavumut tikigunnalaarmangata.
Current plan is that for workers entering communities, so construction workers and others, it would be the same as it was last year, that there'd be a 2-week isolation period and then coming north under most circumstances.
Mano ya pamno tau si mai tamako ekna ya ti pillugi nunalinnu ne to akata tai ma chaina sulimakku ni pinasa ko sini ani daily kay nakakaya me.
I'm going to answer the Canadian press. Our Chief Public Health Officer, Teresa Tam, said earlier this week that the territories had all hit the 60% mark of vaccination. You just said it was 30. I'm wondering if you can clarify the number.
I'm a transfer Canadian press kunik dana na ham nang ituliri Amerika na tami Teresa Tam ham nang ago okay up nak tumi abit simam ni you 60% in nitikuti simam billy 30% lakaw gabi kanolita kanoba.
Now, as of right now, we for Nunavut, it's 52% of adults have received at least 1 dose.
Man namulo Nunavut may 52% in night kapiyagun naksisimayot sibulak pa mi ugalaway lang.
I'm wondering if you can talk about the uptake for the second dose. Have you seen those communities who have had their second dose clinic, have you seen the same people come back who got the first dose?
Sa ham nakita ko tuliani kapiyaw ga to khatta tuliani kapiyaw ga ham ningita ko ti khatta to galo kay kapiyaw kan nirali.
Yeah, the majority of people have come back for the second dose. There's always a little bit of attrition or drop in numbers with any 2-dose vaccine in that immediate period. Staff in the communities are working with those individuals to get them caught up as soon as possible.
Tako amisunak sa tuliani kapiyaw ga to khatta to kisani tay ma china kapiyaw yo hatilugo makuni tako ilang kapiyaw khatangin mata kisani kanayak ti nunalin Takwa kawik kay hatak to tayo angut hullugi kapiyaw ga kakote mini kilamiyo yuko.
Jackie McKay, CBC News. I wanted to follow up again on the situations where people are sent to have a re-isolation plan within the territory. Can you speak more about what supports are in place in the territory to make sure those people are following those plans and around how many times that has happened?
Jackie McKay, CBC, kung napariga kan na kumayota ko, piyarilaw tinaganit tayo liga harning tikititaw hatak to kisuni kayo titakakata ko malit sa alagalaw mga tamaligalingin ni kawis ako taw hatak to.
I don't know off the top of my head how many times that has happened. The supports are going to vary greatly from case to case. Some people need no support whatsoever. Some people need almost daily support. Some people have needed to be isolated here in territory for admitted to hospital. They're coming back because of severe illness or something along those lines. So it varies a lot. We do whatever we can to keep them safe where they are and keep the community safe from getting a COVID-19 introduction.
Kaya mangita ko akatsi mga tatay may hataka hasimayo. Kasi ni ato ni kayo tiyo hataka li adjigay ngito hatangata ilangi kayo taw ga hangin sa mga ito ilangi ulo tamay kayo taw hataka li ilangi tamay no na bumotak sa kay taw hataka li so la na bimo ni titaw chaw tigilo tik so lo hani mabidwa to hakat adjigay ngito maro hatangata kasi ni kanuli ko ta hatak do at tanak tumitay li titsinang mot amalo no nakatimini at tanak tumilik titsitay li kullugi.
Following up to Kent's question about what's happening in the South and the impact on us, you spoke about different variants in the South. Is the Moderna vaccine not protective against some of those variants, and are you weighing that, and is that weighing into the decision?
Aperikan nilo niyo kaya ko sa kaya halunani kanuilo niyo yuwatin at tuwin nakakatangan takwa sidjak palya yun no badjuan na isang nilak palya ni kakto yun dahil na madara na kaputi yun tayo mailangin na kaya sa pumit yu tawagun nang imata ko nung asidjak palya yun no.
Yeah, the vaccines have varying degrees of effectiveness against some of the other variants, and there's research being done to get accurate information on the changes in effectiveness. So it's partly that research, and it's partly watching the trends of the variants in the south that will help guide those recommendations and decisions.
Tako nila kaputi adjiging itu no atu te harunang adjiging itu me ilangin no atu te harunang alwaksuni kasi ni taman na kawi sakta wala yo ima tamas namang itu ni tu kasi magjuta khatsarun na khuluta khanutigi atu te harunang mga tamakkunung asid jak pala yo no tay may mat kawi sak pala ngin naktabu khaluna ni khanu ilo pala mga tamalo asid jirutigi batutigo tamakkuning atu le jutigi simayatin ni amalo isumalo yo jutigi khataktatin ni.
Kent Driscoll, EPTN National News. Dr. Patterson, one of the few groups that get to skip the 2-week quarantine are essential workers. Now that there are more vaccines available, has your department put any thought into requiring essential workers to have a vaccine before they get to skip that 2-week quarantine?
Kent Driscoll, EPTN kumni Dr. Patterson takwa ilangi anik teiliga to khattangin mata sulu tamakko yakanayak to yakallaritu anik teiliga khattangin mata takwa. No,
well, we've thought about it. The answer is no, we're not going to require it because it would quickly become counterproductive. So people who are coming from other parts of Canada as essential workers will, in many cases, not have access to vaccine at this point, and so we'd be causing other problems where critical or essential services would suffer, and so the answer is no.
Agata na isa matsaksi utaw si mayugalo kisani tay may gahati chijang ito atu te khayang imman kikutu na yasing ni kanata metikin na tilugin amisu atu na hangim mata kaputi misule tanala singin ni kata akaw ngilo te hati chitu na legayang ata ko kapiyaw ga haksiti si malugit tamakko lo pilirang ulaki gali kingo balwa legayang ata tay may aga kapiyaw ga hakasi magyatong gitichiyo.
What's the anticipated date when every Nunavut community will have had a chance to have both doses of the vaccine?
So Pond Inlet was the last community to get a mass clinic, and their first one started Tuesday. So 4 weeks from Tuesday, every community outside of Iqaluit will have had 2 community-wide clinics.
Kingulak pamitan na mitsi matalimit kapiyaw hatalawtut naggadyaw likiwlawtut mitamakin ni kapiyaw si malilawtut Iqaluit sila tani tako nunalilima ilum nati tamakin ni makun ni kapiyaw biyo si malakton.
Tobiyo taksibisi kunni kanina yak palitak ko kapiyo yu sibulami awlaga kangnak pat nunaringan ni anabing mulukya tana kingulinga tikyu tikpat kanitaga kakayakpat. For those who are getting their vaccination and got their first dose and something happened, anything, accident or anything, what will happen to the person who got their first dose and they had to travel to another, like to Iqaluit or another health center, hospital? What will happen to them for their second dose?
If they're in Nunavut, we'd encourage them when they're about 4 weeks from their first dose to call wherever they are then and see if they can get on the list. If they're in the south, they should call their local health center when they return to Nunavut. As long as the second dose is given within 4 months after the first dose, it is safe and effective, and they will be well protected until they get the second dose.
Nunavut mi jaangikuti taakko pinasaarusi sitamai naatillugi nunaminni jaangikuti taima oqaalagunnartu aannearbi matiliuqatauga yartu taikani nunalimmi asigiyangani kisaani qallunaani ingaarneruti aannearbimmuut nunaminni utiruti oqaalagunnartu taima tulliani taqqi sitama tulliani ila akunningani attanangittumi tailigunnangata sivullerpaami kapiyolautillugi